Welcome everybody to another wonderful episode of Our Community Cares. I'm Daniela Levine-Cava, County Commissioner, District 8, and we have been bringing you public affairs programming to show how we are all coping and dealing with this COVID-19 pandemic since the beginning of its impact here in Miami-Dade County. Today we have a very special program. We're going to be highlighting disparities in the impact of this disease on the African American, Caribbean American, communities of color. We have experts who focus on these issues even pre-pandemic and especially now post-pandemic to see what are the accentuated results that we're seeing and also what can we do about it. So I'm very, very grateful to our speakers. And before we get going with the speakers, let me give you a little background and then the rules of engagement. So first of all, we know that disparities in health and healthcare have already existed in our country and in our community for decades, for centuries. But this crisis has exposed that in a new way that we hope will lead to insight and action to really address those disparities. And just to give you a couple of the items that will really tell the story, we had the surveillance study recently done in partnership with the University of Miami of randomized population to see what was the incidence of COVID in the community. The net result was about 6% of the population had been exposed to the virus and had the disease, or either were having or had the disease in the past. And unfortunately, of that, the African American and Caribbean communities were twice as likely to be affected, twice as likely to have been infected by COVID-19. And this also translates into the hospitalization and the death rates. So for example, Black residents account for 23% of the hospitalized for COVID-19 and fully 27% of the deaths, while they're only 18% of the population. So the results in terms of seriousness of the illness and even death are very, very apparent. So today's panel has public health, community health, and economic experts who will help us understand this phenomenon and will delve deeper into not only the problem but the solutions and how we can remove barriers to healthcare and economic injustice. So first, let me introduce the distinguished panel. I'm going to introduce Dr. Cheryl Holder first because she'll be our first speaker. And Dr. Holder and I have known each other for many, many years when she was doing community-based work, particularly in North Dade, and I was at Catalyst Miami, then the Human Services Coalition, and I'm delighted to welcome her. She is she's a physician. She's the president of the Florida State Medical Association, and she's co-chair of Florida Clinicians for Climate Action. We just learned that she's doing a TED Med talk released on June 1 that will deal with this topic. So we're excited about that. She advocates for comprehensive medical prevention and care strategies with consideration for the environmental outcomes that impact the vulnerable and low resource populations. I like that way of describing it, low resource populations. Her work assesses the impact of social determinants of overall health on health outcomes, and key among her efforts is her work around HIV and the broader health impact associated with climate change. We'll have an engaging show. I want to encourage everybody to, if you want to engage on Facebook Live, just post there. And for all the panelists who are on the Zoom call, we will open up your microphones at the end if you raise your hand. So we can participate either if you're a panelist or if you are on Facebook Live, either way. Then after Dr. Holder, we'll hear from Dr. Roderick King, also a longtime friend since he moved to Miami. How many years ago? We'll find out. But as well, he is a physician and also Master's of Public Health. He's Associate Dean of Diversity, Inclusion, and Community Engagement and Director of the MD MPH program at the University of Miami Miller School of Medicine, and he's CEO of a nonprofit called the Florida Institute for Health Innovation that deals with these issues on a regular basis. This institute is one of several sister public health institutes throughout the United States that works through innovation and collaborative change to improve community health. And last but not least, we want to know what is the economic impact of all of this. And we have with us another longtime friend and colleague, Dr. Ned Murray. He is Associate Director of Research at the FIU Metropolitan Center. So we have our two great universities represented here. Dr. Holder's with FIU, as is Dr. Murray, and Dr. King with UM. And this is the center that is the leading urban think tank in South Florida, with an overall goal to provide decision makers with the best possible information to formulate public policy, including much of my own. I've worked on many policy formulations with FIU, and also to implement solutions to problems that confront us here in South Florida's urban areas. And towards that goal, the center provides research, training, and technical assistance to many governmental and nonprofit organizations in South Florida. So again, welcome to my three wonderful panelists. We're going to be going for a full hour. Most of our community cares are shorter, so we'll have plenty of time to have a really great exchange. Post your questions on Facebook Live, and also anyone on the Zoom panel can join us at the end. So let's start with Dr. Cheryl Holder. You're familiar with the data that I mentioned at the beginning of the show. African Americans, Caribbean residents, twice as likely to be infected, and 27% of the deaths. Can you help us understand how this could be so? Thank you, Dr. Holder.
Good afternoon, everyone. I'm glad to be here. And I always like to start with, during this pandemic, just memories of those who've passed and those families who've endured the losses during COVID. And we're here, and it's still a hopeful message as we go through this information that we will find a way to do well and overcome. The African American and the Black population in Miami, as well as much of the US, have reflected years and years of having inadequate health care and the combination of many of the diseases that makes you have worse outcomes when you get infected. Diabetes, high blood pressure, obesity. One other area that is not discussed, but many of the populations live next to polluting areas, highways, and pollution we've seen is also related to having an increased risk of having poor outcomes with COVID. So you have the combination of poor health care with the chronic diseases that we mentioned and heart disease. So when you get a severe infection, you need your immune system to be able to respond. And that immune system is already worsened. We didn't even mention the social stressors, which we've seen with the Black population, a poor population, which increases your cortisol and a lot of physical reasons. So then when you get this, you're not likely to respond with a robust immune system, which will then fight the disease. So we're seeing the long-term, the poor outcomes for a population that you explain why they're much more impacted, because we live in the densely urban communities, more public transportation is used. You can't segregate in your home, so someone will bring it home. And we'll get into it more. And I think it's very clear that when you're not as rich and you can't take all the prevention and say, I'm gonna work from home, you do then get a likelihood of being infected. And then you have the health issues, which means you will not respond as well. So it makes complete sense in what has happened. And it's very unfortunate because it's amplified something that we know has been happening for centuries in America.
Thank you, Dr. Holder. And of course, we know that so many of the frontline workers are in communities of color. And like you say, they're not able to take maybe the same protections, precautions. They must go out into the workplace. They're not able to be safer at home as some others may be. That's such an important point as well. But also there's the issue of insurance. And we know that many of these vulnerable individuals don't have the same access to healthcare insurance, so they might not have a primary healthcare physician or a medical home. So what happens when they seek treatment and they don't have a primary physician?
That's so important. One of the frustrations that I'm with the Florida State Medical Association, which represents the over 2,000 Black physicians in the state. And when we heard, one of the first things was call your doctor. And we knew that the insurance status in Florida of poor people, especially poor adults who have no minor children, you don't qualify for Medicaid, there's no Medicaid expansion, and you make too little to get Obamacare. So then who's your care provider that you're going to call? So many of these are left calling federally qualified health centers if they're part of that, or they're calling the health department, which is often not staffed sufficiently for the onslaught of calls. So really, where are these folks going to go and who are they going to call? For the lucky ones who may call the main hospital system, many go to Jackson, many go to the clinics in Jackson, and we know they're never staffed sufficiently. So it leaves the word by mouth, it leaves the community giving the information, and that's why very early in this epidemic, there was the myth that Black people didn't get this infection. And that was a very dangerous myth that many of the doctors in my organization and around got on radios, we wrote articles, we did what we could to get the word out that that's not correct. So the healthcare system not having access and then not having the trusted messengers within the system that they reach out to does make it much more difficult.
Right, thank you. That's so critical, and thank you for your efforts to overcome that. Now, what can we do to tackle this kind of bias that is in our healthcare system and overcome the barriers to trust, and especially during a pandemic like this?
Well, you know, to get trust, you have to see that you've been heard. And I think that's the foundation. And these forums and many of the newspaper articles and the showing of the statistics and real good data across the country, unless you've been somewhere and you've not wanted to watch the news, I think everyone should be aware of this disparities and to recognize that this didn't just happen overnight. So the first thing to get across bias and to even is to recognize that it's happening and recognize what the root of the cause is. And then we need people out there who are doing forums like these, identifying the trusted messengers, and also for the state and the communities to invest and put the dollars where we say. These problems didn't happen overnight. So how are we going to address these issues? And so when the funding comes down to improve and reopen and say what we're going to do, we want the continued support where we find ways that we expand healthcare access. Where after COVID, these folks need post-COVID care. Where are they going to get it? And how are we going to prevent others? So where's the money going to go to help address these health disparities? And then the jobs as they're opening. Most of these people who are vulnerable, and your economics, Dr. Murray will explain that they're probably going to lose their jobs, many of them. So then as we get jobs, how are we going to address it? So medical care is crucial to keep people away from the second round of infection and to keep the ones who've been infected well. So we have to look at how we're going to get medical care to the population that came into this without access to care.
Great. So underscoring that this is not a short term, this is a long term.
No.
I'll say opportunity, an opportunity to really step up
yeah.
and address this disparity.
We can make this better. We can reopen better than we did before, because now we know, and you know what they say, when you know better, do better. So no one can hide and keep their head down and says, oh, we didn't know. President Trump said it on one of his things. He said, why are the Black people having it more? We should look into that. And that was great news to hear that he was awakened to the problem.
There you go.
And so when you know better, you do better. So that's what we want us to do. Thank you.
Very good. Well, for the last question for now, I just want to pivot to your commitment to climate change issues and how you see this fitting in to the larger issues of climate change, the vulnerable populations, and what can we expect to see in coming years, and what should we do about that?
It's the same population that we've been talking about from the beginning. Vulnerable people are experiencing climate change now. When you're looking at the higher temperatures, the flooding, the water, the nutrients in the water, it's happening to the poorer communities. The heat islands, if you track them, they're in folks in trailer parks, in the manufactured homes that cannot tolerate the heat. They're in communities that don't have AC. So we're having the hottest days. But even more important, we got to look at the particulate matter. That data came out that's showing people who are exposed to particulate matter 2.5, which comes out of anytime you see a smokestack anywhere, that's a lot of particulate matter. We have them around Florida. When they burn sugar cane, that's particulate matter. We know when that gets in your lung, you do worse with COVID. So it's no longer just vulnerable people who live closest, but it's all of us. So as the climate gets warmer, when we have to shelter from these hurricanes, that's a lot of people. How are you going to shelter and keep your mask on? So there's so many challenges. Zika, West Nile we just had, not every apartment has screens. So if you're sheltering in your home and you have to open your windows and then the mosquito comes in. So it's no longer just separating this is COVID and this is climate. The intersection is now increasing everybody's vulnerability. Of course, those at the bottom are going to feel it more, but everyone is breathing the same air. Everyone is going to feel the heat. So we have to look at what we can do for everyone.
Thank you. And I think that's a good foreshadow of your talk on June 1. So stay tuned, right?
Yes.
Great.
Yes.
Great. Well, thank you for that
Thank
important information. And let's turn now to Dr. Roderick King. We've already introduced him, and again, a dear friend. So you heard Dr. Holder, and of course you know each other and have worked together on the medical reasons behind the disproportionate impact on Black communities. But what are some of the other reasons that this virus is hitting Black communities harder than other communities?
Well, really to just reiterate Dr. Holder, because she's spot on. The other reasons are the broader, what we call the social determinants of health, okay? So these are the issues around housing, access to care, as you mentioned, education, quality of jobs and meaningful employment. All those things, unfortunately, are worse in some of these communities, and all those things contribute to what we're seeing around COVID. What COVID is uncovering is not new. These aren't issues that, as Dr. Holder mentioned, that just came up because COVID came around. These are issues that have been here for decades, centuries. And now what COVID is doing is accelerating the negative outcomes. So accelerating job loss, accelerating mortality. It's accelerating all these things. So now we can all see it in plain day. So, there are so many other factors in the community that are also contributing to this. And in the broader context, we refer to them as social determinants, but these aren't new.
So as the pandemic unfolds, we've seen a lag in data, and now we have the scandal of the firing of the chief data person for the state. Are we seeing changes as cities and communities reopen? And has that, has the data caught up with what's actually happening on the ground?
It's a great question, Commissioner. I don't think the data has caught up yet. Just from talking to a number of folks in other states and even some of our efforts here within South Florida. There's normally a lag anyway between the collection of data or reporting of data, even without COVID. But I think it's been particularly troubling to see how much that delay has been happening here and how much data is missing. In some states across the country, there's some questions about how the data is even calculated to kind of lessen what the burden of disease looks like. So I think to your original question, whether the data has caught up is, no, it hasn't caught up yet. And one of my biggest fears, and I'm sure Dr. Holder probably also holds this, is that we won't truly know the major impact this is having on communities, particularly communities of color, almost after the fact. And it's heartbreaking to know that, and to know that there are probably deaths and illnesses that are happening right here in our undisturbed and Black communities that people aren't even counting, and we're not even taking note of. And we won't figure this out until after the fact.
Well, and we did know that at the state level, with this confusion about who was responsible for maintaining the dashboard, I know there were several days or weeks in which the data was down, and I was hearing this morning that researchers that are depending on that data, they grab the data so they would have something to rely upon. But obviously that skews it for all of us as we're trying to understand the impact. But also I have to say locally, it took some prodding to start to track some of this data by race and ethnicity. It was not automatically done, which was really disturbing. So, hopefully now we've improved upon that with some of our local tracking, but and there's fights about who can reveal the death data, whether local medical examiners can release that data. All of this undermines the public's confidence in what we're seeing. Okay, so many frontline workers, it's been said, Dr. Holder mentioned it as well, are bringing the virus home to their families. And that includes transit workers, our home health, our nursing aides. That's part of the problem with the nursing home spike.
Right.
The grocery store cashiers, you know, they're getting more of a viral load, right? Because we know we understand that the air circulates with particles from the virus, and you want to be in a closed space as little as possible. But if you happen to work in one of those environments, now you're multiply exposed. The correction officers as well, where of course we have now 41% of those tested. Not everyone has been tested. 41% in the county jails who have been tested are positive, fortunately, with a very low death rate, one person so far. So what are some of the ways that we can protect our essential and frontline workers, not only for the populations they serve, but for their families and for community spread? And this particularly, we know, impacts the Black and communities of color.
Great, thanks. Thank you for your question. I think, you know, that there's just the fundamental protections that people have been hearing about that I would just implore that our frontline workers do, which are wearing the face mask, when possible, you know, maximizing your distance as much as you can. Sometimes, Commissioner, it's disheartening when I get a chance to go out and say buy groceries, and I see folks from the community that have a mask only on the bottom part of their face and don't cover their nose. I implore people to just wear the mask the way it's supposed to be worn. I know it's uncomfortable.
Right. Yes,
I recognize that it's hard to talk to and people to hear you. I know it's not something we're used to typically. I mean, Cheryl and I are used to it from being in the healthcare environment, but please, if folks just wore their mask properly, did good hand washing as needed whenever they're in contact or using hand cleanser. When needed, if you happen to be a place where there's a viral load, as you mentioned, Commissioner, to wear a face shield or have some kind of shield to block the spread of any aerosol spread. Any of those things, I would just hope that people would kind of just embrace those and do those. I think the other side of it, really, as you touched on, is what happens when they leave work, right? And, you know, for many folks in the community, there is no luxury of, you know, going to stay at another house, right? There's only one place they can go back to. So what we have been trying to encourage folks is, you know, when you are returning from home to, you know, immediately wash your clothes and take your clothes off and get those clean as best you can before you even come in contact with the rest of the family. You know, go through your normal bathing hygiene that you would go to again before you start connecting with the rest of the family. And if you're really concerned and there isn't any other space, what we've had said to some folks is if there's a room that you can kind of just keep yourself to, or just by yourself alone, that would, again, minimize any kind of spread that would happen. And again, the idea there is that if you happen to get any virus on your clothes or on your hands and wherever it might be, that by cleansing and taking off your clothes and washing them right away and potentially isolating yourself for a little while till you have to go back to work, that would be helpful. Because, you know, our big worry, and I know Dr. Holder also holds this, is that we don't want our frontline workers to become vectors of the illness. We don't want them to bring this home. If there's a grandmother or a grandfather or someone else that is really high risk of getting very sick from COVID, we don't want our frontline workers to be the ones bringing it back home.
Well, and we know, again, if you're lower income, you don't have a spacious home, you don't have places where it's easy to isolate, then that's more spread of the viral load in a household. So this is, you know, we know, I mean, CDC told us, you know, all the medical experts tell us we need adequate testing, we need adequate tracing, and we need the ability to isolate. And we really have not fulfilled any of those three criteria in the nation and even in our community. We've increased the number of tests that are available, and now through the county, you could get free testing at multiple test sites without having overt symptoms. So that's definitely a step in the right direction. And of course, we're trying to test more of our direct healthcare workers, firefighters, police, but it's not universal by any means. And these other frontline workers are not getting the testing. The other thing is the PPE, the personal protective equipment, is hard to obtain and costs money and expensive. And it is expensive. So, you know, thank you, John White, for the comment on Facebook Live that we need to make sure that that happens. You know, the mayor put together a business kit for businesses reopening, which includes supplies for those workers, which, for a time, which is certainly a good effort, but we know we have that multiplied everywhere. And like you say, educating people not, to have the nose and the mouth covered and properly sealed and so on. Okay, and as far as isolation, we do have some isolation rooms for the homeless if they have been diagnosed, but only if they've been diagnosed. And in hotels, we're not offering it to others. And we also have some for Jackson workers that were donated by the Milton Family Foundation, but not adequate. It was a great gift. Unfortunately, there's more needed. So, okay. It was also posted that there is a really important report that the Florida Health Justice Institute put out on disparities in the COVID era. So we're posting that link and want to encourage people to look at that.
So if I could add one other thing, Commissioner, two quick things. One is we're now getting more feedback and communication with the Department of Health that they are trying to ramp up their efforts around contact tracers, because as you mentioned, that's part of the big three. The tracing is a critical component to that. So we're happy to see that. But as you mentioned, I think there needs to be a lot more. And if you look at some of the data in terms of how many cases we have and the number of tracers that we need, we're not there yet. And
we need about 800 to 1,000 contact tracers in our population. I know our county mayor has said he's committed to making that happen, but it's really a Department of Health function, and they're not yet, they haven't yet designed and implemented the program. So we've opened up without the contact tracers being in place. So, we're all, people are eager. But we still
have to keep the contract tracing to be very culturally appropriate.
Yeah, that was my second point. Thank you, Cheryl.
Yeah, it's been delayed, the language and the access, and where they even put the media notices out. Radio, very strong for the Haitian community. There wasn't as much there. The Opalaka testing site opened today. Coconut Grove is going to open probably this week or next week. So this is when we're reopening, they're getting the first testing site in some of these poor Black communities. So this is the issue that we're concerned. We want the urgency in the response. So you cannot hire contract tracers who don't speak the language, who don't understand the culture. They're not trusted. So we hope that the community understands.
Right. So we know the Department of Health is rolling it out. Miami-Dade College just put up a 4-hour training program. I know community health workers at the community health centers are ready and willing to be deployed. So there's a lot of eagerness to move forward. But we have to do it right, and we have to get going. So very good. Well, let me just finish on this note with you, Dr. King, for right now. As this is a crisis of a dramatic scale, how do you see it reshaping our society in lasting ways, for better or for worse? And are there already signs that we're tackling these disparities head on? Are there signs of hope? And where do you see lagging, like complacency, not moving forward?
Well, I think we talked about the lagging part that has been disheartening is the slow response, as Dr. Holder mentioned, about opening testing sites. So we know that well, but I think what this does is makes it really, really clear that we have got to do something from a programmatic policy perspective to address these disparities. I mean, if this doesn't kind of get us in gear to figure out what we need to do to improve the safety net for these communities, to improve access to care, to tackle the social determinants, I mean, I don't know what will. And I think this is really a call to action. I've read some great pieces about sort of when will we return back to normal. And many of us, particularly those of us that work on disparities, say that we don't want to go back to normal because the normal was broken. It didn't work before, right? And people were dying, as I've mentioned to you before, Commissioner. It was just that they were dying at a slower rate. So, we don't want to go back to that normal. So this new normal that we're hoping is that we can use this opportunity to really recalibrate and think about how do we improve all the elements that Dr. Holder mentioned, and how do we tackle some of these particular areas and think through different ways. And that's going to be the key. We can't just say, for example, with testing, well, we're opening a new testing site. Well, it may have to be done in a slightly different way. And what does that really mean for that community? And one of the areas that I'm hoping is that right now testing is passive, meaning that you're expecting people to come out to go get the testing. And we know from global health experience, you could look at some of the work of Paul Farmer and others, you have to go out to the community to be able to both communicate, and as Sharon mentioned, that the messenger is important who does that communication, and you have to be more active in doing the testing. You can't just open a testing site and sit there and then say, well, nobody comes to the testing sites, right?
Well, and just another example is we provide food at food distribution, but you have to have a car.
Correct.
So we just passed legislation to explore, you know, how else. And we do have one nonprofit in partnership with the county that is doing home delivery. The seniors are getting meals delivered. But, you know, we really didn't go into this fully understanding the magnitude of the need and how to reach these different
So these ideas are right, but the implementation is the key. And it's got to be culturally appropriate, whether you're talking about the elderly, whether you're talking about the Black community, whether you're talking about the Haitian community. You can't just say, well, here's a strategy, but we have to be able to be more flexible in doing that. So, you know, it's disheartening to see, but I hope that we're going to be moving into a new normal. And this data hopefully will catch up, as we talked about before, and it'll help us drive the strategies and the policies that we need to put in place based on what the data is telling us. And
excellent, excellent. Thank you so much. Great. All right, let's turn to Dr. Ned Murray. Thank you for being with us. And we introduced you in absentia, I think, but thanks for joining. And we've discussed the health and social outcomes for vulnerable and underserved communities. And what about the economic fallout for these communities as we begin to emerge, whether we are ready or not, from this pandemic? And how has it already hit our workforce and businesses in communities of color?
Well, hello, Commissioner. Hello, Cheryl and Roderick. I do say that what Roderick just mentioned relative to you know, the fact that we're finally recognizing the health issues in our Black communities and communities that are more impoverished. It's just amazing that it took a disease pandemic, you know, for people to actually begin to understand the scope of that issue. Certainly, as we've done our studies over the years, over the decades now, more on the economic side, of course, we have factored in a number of social issues as well, including health. But these communities of distress, which we were able to really focus in on in Miami-Dade, thanks to the prosperity study that you were a champion of, Commissioner, we were able to really look at that, what we refer to as the spine of distress, which extended from Miami Gardens all the way down through Homestead and Florida City. And it was along that spine, that whole corridor, that we found some of the older established Black communities, obviously newer immigrant communities, and the levels of distress in terms of unemployment, in terms of poverty, particularly children in poverty, lack of educational attainment. All these issues were really pronounced, and these communities just stood out. The disparity between what was happening in these communities relative to the county as a whole were just really staggering. In fact, we had mentioned back then, you could take that study right up the 95 corridor into Broward and Palm Beach and found the same thing. So, so who's being impacted? Well, these are the communities that are being most impacted. In terms of economic loss, the unemployment that we're seeing in Miami-Dade County, and just as a point of note here, Miami-Dade is leading the whole state in terms of job loss. Of the first 1.1 million claims, close to 150,000 were out of Miami-Dade, which is, well, there you go, 11%, and we think those numbers are probably much higher. So if those numbers equate into the actual job numbers that we expect to see sometime in May or April, we are looking at, you know, well north of 100,000 jobs lost in Miami-Dade County alone.
And talk about the Black-owned businesses particularly.
Well, these are the businesses that are always going to be most impacted, because for the most part, they are in those sectors: retail, accommodation, food services, social assistance. These are the industries that are most getting hurt, and we already knew this. A study that we do every year that you're familiar with is the study we do for the Miami-Dade Economic Advocacy Trust, where we drill down to the 17 targeted urban areas, which are predominantly African American. And we do look at businesses, we do look at other economic numbers. And in the 2018 report that was just completed, so this is pre-existing COVID-19, we saw business loss in 14 of them. 14 out of the 17 had experienced business loss, and some of them were really, really staggering. Opalaka had lost over 50 businesses, Carroll City about 45, Little Haiti around 45. So that issue was already in place, and of course there's a lot of other reasons for that, including what we've seen in Little Haiti in terms of gentrification. But by and large, the economic conditions in the Black communities of Miami-Dade have gotten worse, even during a time pre-COVID when the unemployment rate overall was under 3% and we had record overall employment. So levels of poverty, levels of unemployment, housing distress were still quite evident in all these communities, and now we know it's much worse.
Okay. All right. And of course, many of these are businesses also where risk of infection is very high. So it's going to create that much more difficulty in recovering because of the fear factor. And we know that the public is voting with their feet. And what is it, 74% don't think it's safe to fly, and 55% don't think it's safe to go to a business or a restaurant. So, you know, the fear is very justified and very real. And that is what we're facing as we seek to recover. So most recently available Federal Reserve data also shows that Black business owners are denied loans at twice the rate of white owners. So they're much more likely to have trouble finding capital to survive the pandemic. And we know that also with the Paycheck Protection Program, they were less likely to receive that funding as well, partly because of not having relationships with existing financial institutions and the like. We're on the second round now of these small business funding programs. And of course, Tuesday we did pass a county program. I was pleased to sponsor that. That will allow us to use dollars up to, for businesses up to 25 and up to $25,000 in forgivable loans. And we want that money to get particularly to the areas that have not benefited. And that's the criterion, right? It has to be for those who've not benefited from receiving other funds. So the measure, though, the new program that's making its way now, did not stipulate that minority-owned businesses would have priority, even though they were more overlooked in the first round. So since the feds didn't seem to get it right, what can we do at the local level to offset some of the actions to access? And what else can we do to take the lead in helping these businesses survive?
Well, it's a great question. Let me first say this. We have 82,000 business establishments in Miami-Dade. 81% of those are under 10 employees. 67% are under 5 employees, so they're micro businesses. We have an issue not only here in Miami-Dade, but around the country in terms of microcredit and microlending. Obviously, there's some good success stories around the country and around the world, for that matter, in this regard. But that is going to be fundamental because most of these little businesses, I mean, we're talking 81% under 10 employees. They don't have the credit. They don't have even the probably the access to or knowledge of where to even go for credit assistance or financial assistance. So that's the thing we're going to need to focus on. And one of the advantages we have, and you know this very well, the best micro lenders are nonprofits. We have one in Axion, who's here. They do a great job. Obviously, we have DSBA, Kiva. There's a number of them that are there, but we even have other organizations that are probably capable of doing that. So the cavalry is not going to come. I mean, we're not going to see anything out of Washington and certainly Tallahassee that will really make a difference in the types of businesses we're talking about. Minority-owned small businesses that really need a micro lending and ongoing support. We need to establish our own entrepreneurial environment for these types of businesses, our own entrepreneurial culture around that, building that capacity within the communities themselves, not just at County Hall or some other location, but to actually extend that kind of capacity into the communities via nonprofits and other vehicles. And in doing so, really begin to understand what are the specific financial needs of these small businesses. So that's going to have to be done locally, Commissioner. And I think the counties and cities around the country that understand that and can do that and can generate that type of assistance are the ones that are going to make the biggest difference.
Great, thank you so much. And let's just finish with you on this question. Long term, what do you hope will come out of this, and what changes for the better could we see as a result?
Well, I concur with Dr. Holder and Dr. King on this. Let's hope that we don't go back to the way things were. This is an opportunity for us to really go forward. I'm working on a paper right now as part of the Metropolitan Center's overall COVID research on the reindustrialization of not just America, but in our case, the reindustrialization of Miami-Dade and so forth. I'll keep the scope of that geography more focused. But what does that look like? What does reindustrialization with a human face really look like? What can we really do in terms of building a resilient economy? Let me say this, and you're well familiar with this, and I think it's a really important point as we think forward on this issue. When we did the prosperity study, we laid out the four pillars of prosperity. The first one was stable building a stable economic economy, mobility, opportunity, and equity were the other three. And I'll leave those three separate for now because those three I think we spent a lot of time on. The one that didn't get a lot of discussion was creating a stable local economy, one that can help avoid economic shocks, one that can be much more resilient, and also one that provides all those opportunities down the road. So we need to be thinking about that. What does that look like? Because we're dealing with a pandemic now, but 10 years ago, we were dealing with a recession. Before that, we were dealing with 9/11. Before that, we were dealing with two other recessions. We're going to have recessions every decade just by their nature. We need to prepare for that. But I think more importantly, to address the issues that you're focused on today, we finally got to deal with these levels of distress that have been in the Black communities of Miami-Dade for decades and decades, and we really haven't moved the needle.
All right. Well, thank you so much to all of you. We're going to move into the questions component here. And for the Zoom panelists or the Zoom audience, you may raise your hands now and you will be called upon. And while that is starting, because we hope that this will be a robust conversation, we had a question on the Facebook Live side, and that was from Noelle Alvarez. Thank you, Noelle. What about undocumented or people of not full immigration status? How can we be sure that they have access to the testing, to the programs, and or even feel comfortable approaching the same? And I think I'll turn to Dr. Holder for this. You're muted, Dr. Holder. You have to unmute yourself. Okay. Andrea, great.
Okay, all right. Yeah, well, I'm at Jackson. I provide a lot of the healthcare there, and my population has a lot of undocumented and homeless. And I can tell you that the fear of the immigration policies have decreased my visits even before COVID. So I feel if as a society, I think telemedicine gives us a great opportunity. So if anyone is asking, where can you put the funds? I know CARES Act released millions of dollars to the county. That's over 500,000 people. And this money has to be spent in 6 months. How can we develop a system where we can use telemedicine that gives folks access to care? So I don't have a patient that has to travel all the way from Homestead to come to Jackson to see me. So how can we develop a program like that, which then takes the pressure off whether you prove your undocumented status or not, and we can find a way that makes it much less expensive if we can use systems like that. other than that, we have to have a structure where people will feel comfortable that they're not going to be reported to immigration. They're not going to be yanked off buses, and they're not going to be afraid to get care. So that's, the culture has to change. And I think telemedicine gives us an opportunity to really provide decent care.
That's such a good point. Thank you so much. Okay, we have some folks from the panel. I guess I'll just call them in the order that I see them. Antonella Pena. Let's go ahead and unmute Antonella's mic.
Commissioner, you should ask them to raise their hand if they have a question.
Okay, so please, anybody, I see you now, but I don't see hands. So how do I look here? Please raise your hands, anybody. And then our behind the scenes mavens will recognize you. Okay. Okay, Antonella, please go ahead. You're unmuted, Antonella. Just what's your question? Please tell us your question.
Oh no, I'm sorry. I unmuted on accident. Sorry.
Okay, very good. Anybody else have a question? Raise your hand. This is the first time we're doing it like this. We're getting to be Zoom experts.
We have Betsy Skip.
Oh, very good. Hello, Betsy, my dear friend, with results and ending world hunger. Thank you, Betsy. Tell us, what is your question?
And domestic poverty as well. And I wanted to thank Dr. Holder for being with our group last week. I also had asked in Facebook, but I don't guess I'm doing it wrong, about the immigration undocumented people. And I'd like to know if any of the panelists are also thinking about our global health and how it affects our own little area of Florida and what we're doing to combine global health with domestic.
Anybody want to take that one? Global health? Go for it, Dr. Holder, and then we'll hear from Dr. King. You're on mute. Dr. Holder, on mute. Okay.
Right. Yeah, you guys sort of control it, then so there's a little delay. One thing with so many of our communities are immigrants. So where we're seeing much of the issues, the stress that involved as our community cannot continue to support their families abroad. And the relationship with tourism, I see that's going to be a big issue for our community, since so many of us work in that industry, in the service industry. So we know that if places like Brazil are not well, we're not going to see the tourist people, the tourism levels. So the whole world, we're all in it together, like the cliches all over, but it does impact who's going to be able to come as a tourist to Florida and support the jobs, because the entire world is having the impact of the health, especially places like Brazil. The Caribbean has done very well because of the good health infrastructure and the public health response. So, but we know there are other areas.
That's such a good point, that even poorer countries have better public health response, right? Let's just underscore that. Thank you. Dr. King?
Yeah, I agree completely with Dr. Holder. I think the one thing that's come out of this pandemic is how interconnected we are with all of our global neighbors. At some point, we will have to start opening our borders, as Dr. Holder mentioned, and we're going to start having this influx of people coming back and forth, partially driven by tourism, partially driven by many of our communities that serve the tourism industry. So I think, we don't know right now what the global health impact will be on us in terms of our current pandemic situation. But I think it's important to watch and see how some of our Caribbean countries are doing it, how some of our Central American and South American countries are managing it, because at some point we're going to start to open the borders, and then that will add sort of a level of complexity of people now moving back and forth. And unfortunately, not every country is managing it the exact same way. As you mentioned, Commissioner, some countries are doing an amazing job, and some countries are not. And so we're going to probably see that as part of the next phase of sort of where we transition with this COVID process in the country, is how do we handle the global flow of people coming in and out, especially for a place like Miami.
Excellent, excellent, great. So we have a question now from Kathleen Elliott, another community partner who works with youth. Kathleen, please unmute and let's hear from you.
Okay. Hi, thank you very much for your focusing on this issue. As you know, we have been impacted. One of my questions is, how is the problem with 5G going to affect the pandemic response? I've heard many studies that this is impacting our community in a greater way than it is other communities, and it may be reducing our resistance to the impact of COVID. So can they speak to how 5G might be playing into this?
I'm going to send it to Dr. Holder, and I think if you could, Andrea, help her unmute her mic. Okay, we're all multitasking here. If not, oh, Dr. Holder. And I'm going to call on Eric Besson after that, and Stanley Rigaud and Eric Helm.
Yeah, I'm back.
Put your raise hand on the board. Please, Dr. Holder.
Okay, the data I've read on 5G has not, has not shown a relationship in health as yet as what the anti-5Gs have shown. So I haven't seen enough proof to say that it is impacting our immune system in that way. What is definitely clear is pollution has an effect. So I can really focus on the data that's proven, and we know pollution has tremendous effects on our health and our immune system and our lungs. So that has been proven. The 5G has not been proven as yet. So I don't know if Dr. King has any more information on the 5G, but I don't see right now the threat is not 5G, but the threat is much more pollution and greenhouse gases, and those have been proven.
Okay, if you have something to add, Dr. King?
No, I would just echo what Dr. Holder said. We don't know enough definitive data on 5G yet, but there are so many other bigger threats that we're facing right now, including the air quality issue.
Very good. Okay, let's turn to Eric Besson. If you could unmute your mic, please.
Hello. Hello.
Yes, we hear you.
Oh, okay. Hi, Daniela, and hi, Dr. Holder, and the rest of the panel. My question is this. We're talking about health disparities and that mostly that is Black people that are affected. The bottom line is that they're affected because people are basically racist and they're not being held accountable because of their behavior. So people are allowed to use their positions of power to inflict racism on people. So how do we address that issue there of holding people accountable? Because the only way that this can exist is people are allowed to continue those actions. Like if you go into a health facility and you can give like, you have Black women that have a college education making $200,000 a year, and then you have a white woman that goes in and she has a crack addiction and she still hasn't finished high school, but she comes out with her baby, but a Black woman with an education and better health insurance side. So some of these things, you have people using their position to hurt people, and they're allowed to do that. Like let's say you have the president that's a racist, you have governors that are racist, you have judges that are racist. How can you be a racist police officers, DAs? So how can you be a racist and hold these jobs? And how can we tell our people that, you know, to keep believing in this system where these people are allowed to hurt us and speak blatantly about hurting us, but there's no accountability for it?
All right, Eric, thank you so much for bringing up this issue. And not only do we have issues of implicit bias or maybe overt bias, but in this social distancing arena, and obviously we have to take all of this very, very seriously into account. I don't know if any of my panelists want to weigh in on this point.
Roderick, I don't know. Well, you know, racism has been proven in all our studies that it is one of the social determinants of health. And we've seen the effect that racism has, especially microaggression, the little insults, does change the stress response. And we feel that underlies some of the negative health outcomes that we're seeing. The blood pressure is being higher. When cortisol's higher, your insulin resistance changes. So we know it's underlying some of the health issues that we're seeing. How do we combat it? It's very difficult, but like the first thing is that accepting that it is an issue. And in medicine, and I say in money, I would love that we see that all these dollars that come down to fight and help the poor people, find a way to employ the poor people as we're trying to supposedly help them. Because to create jobs that only spends on high income salaries doesn't make any sense.
Thank you for that. Amen. Okay, so we're running out of time here. So we have 3 people in the queue. I'm going to allow each of them to just present their question, and then we would allow one answer from one panelist, and then unfortunately we'll have to end. This has been a great conversation. So, and I understand we have to unmute you. So next up is Stanley Rigaud, followed by Eric Helm, and then the last will be, well, we'll get back to it. So Catherine Toms. So go ahead, Eric Helm. Oh, we have to unmute you. Very good.
Stanley or Eric?
Thank you so much. So
I reversed. I apologize.
That's okay.
Who's ready?
Okay. Sorry. So my question was, you know, some of the reports that we've seen of police arresting people who do not have homes or are economically displaced, or tearing down some of the tent facilities in which they are living, but providing no form of, you know, alternative housing, you know, like hotel shelter instead. So what do you think is the best way to like advocate on the city level to get this practice to stop and to increase hotels for people without homes?
Okay, I saw Dr. King nodding. Would you like to weigh in, please?
Yeah, I mean, I think the important thing is, you know, we have something like this with the commissioner, and we get in front of our other commissioners and make our voice known, because this is really unacceptable. You know, we still, COVID or not, we still live in a democracy. It may not feel that way, but we still live in a democracy. And the bottom line is that, you know, until the people's voice are heard, and heard in a way that people feel the heat, things won't change. And I think it's really up to all of us to pick up our leadership, to connect with our commissioners, connect to our elected officials, because they work for us. And so again, like Commissioner today has offered this incredible opportunity for us to have this dialogue. Other commissioners need to be held accountable for this also.
And we're getting some really good information that we can share. So that's been fabulous. All right, let's open up Stanley's mic. Stanley Rigaud, good to hear from you.
Good to hear from you, Commissioner. Thank you for putting this together. I'm focused more on solutions than I am on identifying the problems that we know are there. So my observation and potentially question is, why can't we use the graduates of today and soon to be graduates that are going to experience hardship anyway to create some kind of a Peace Corps, but local Peace Corps? Because I agree with Dr. Holder in that, you know, it has to be something that's mobilized, and we have to go to the communities. But I feel that the students today, whether it's high school students or graduate students, are hungry to contribute in some way. And what I'm suggesting is somehow for us to help both with the economic and healthcare disparities, not just in collecting the data, but also in forging those kinds of partnerships with the banks, the industrial, you know, the big cities, to figure out ways where we can make sure that we're addressing the disparities, but also engaging with them.
Right, and I think that follows on what was said before by Dr. Holder, like all this money coming down, let's use it in ways that can really be repurposed for the better future, right? All of our panelists have agreed this is our opportunity to turn this into something that will actually transform our society. And I very much stand with you, Stanley, on this idea. I've actually proposed something myself, and let's talk offline about your ideas. Thank you so much. Let's go on to Catherine Palms, and that will be unfortunately our last for this session, but for anyone who's missed out, please send us your questions. We'll address them, and Facebook Live or on the panel. So Catherine, where are you?
Do you have me? I'm here.
Yep, please go ahead.
Okay. Hi, everybody. Hi, Dr. Holder. I'm on the steering committee and have had the FCCA, and have had the pleasure of getting to know Dr. Holder. And but my question is to Dr. King. Today I'll try and be brief. I'd really like to hear your thoughts. So I've been volunteering at the Palm Beach County Health Department in the time of COVID, just screening patients and staff. And I've realized I've talked to some of the patients and they notice the connection and they know they're at risk when they have pre-existing conditions like asthma for COVID, but I don't think they're quite aware that they're also at risk for the health effects of climate change. And I just wanted to know if you have any kind of ideas how we can engage public health departments in the area, because they see an overwhelming majority of minority and underserved patients. And so they're most at risk for the health effects of climate change. Is there a way we can engage health departments in learning about and finding solutions and ways to make resilient patients more resilient when it comes to equity, climate change, and health? Thanks.
Thank you so much for the question. Okay, Dr. King, you get the last word.
Yeah, I'll keep it brief, and it's a great question, Catherine. One that we've been grappling with also at the Public Health Institute. The short answer is that health departments are concerned about this issue. We could have a whole conference on this, but under our previous governor, some of you may remember that they were prevented from even saying the word climate change in the health department. So with that type of governance that's in place, many of the health departments were really handcuffed. They couldn't really do a whole lot for communities, even though many, with some exemplary leaders like Dr. Rivera and Dr. Alonso, were still trying to figure out how to support the needs of these communities. I think, you know, that's a great way that we need to get more of our community involved. But the issue around climate that I've been, and Cheryl knows this because we've talked about this many a time, is that we have to frame the issue around climate change around a short-term impact, right? The reason that COVID is so powerful right now, unfortunately and tragically, is that they see it on the news, and then unfortunately people are dying within a month, right? We don't have that direct cause effect in climate change. And so one of the areas that we need to figure out for underserved communities is making the case of how even short-term impact can happen within these communities. Things like increase in heart failure because of air quality issues and heat issues, issues around access to care. I mean, there are all these shorter-term issues versus right now, most of the climate discussion is around things like sea level rise. And most of these folks, I mean, you're talking about a 34-year timeline. Most of these communities, they're just worried about the next 2 days. So to try to make a case with something that's 40 years from now is not going to stick. So I think for us, the takeaway is to continue to encourage and support our health departments to get involved, because I believe they really do want to get involved, and hopefully that will get better over time. But also for us to make the case of a short-term impact of how climate will affect the lives that we serve. And that will help people to see how they can get involved and learn more.
Well, thank you so much to our incredible speakers. This has been a really illuminating conversation, and I wish that we could have it longer. But you can see that we have great leadership right here in Miami-Dade addressing these issues and leading the way with data and thought leadership. And we need you as citizens to engage in these issues and push forward so that we can transform our society in the ways that will make it a better, not the old new normal. So with that, again, thank you, everybody. And we'll welcome you back in the future for future topics. Please share your ideas. Follow us on Facebook, Twitter, and Instagram. And practice social distancing. Be safe, be strong, and be kind. Thank you, everybody. Good day.
Thank you, Commissioner.
Thank you.
Thank you. Thank you. Bye.